Thank you. It's a pleasure to be here, and I'm sorry I missed the morning because I'm kind of interested in the barrier thing, so we'll have to catch up. Um, I'm kind of a wet blanket speaker these days, sorry to say, but uh, what can I say about state budgets that you don't already know? We're in deep, deep trouble. And I think USA Today actually has an article about how we're trying desperately to spend as much of that stimulus money that is slipping away from us and will be gone on June 30th, which has set up a pretty somber group of legislative sessions this year. The stimulus money is going away, but the recession continues, which is not a good thing. Now, there is a recovery of some sort going on, and unemployment is going down in some states and it's going up in others. But it's not going down enough to make a difference, and revenues clearly are not recovering in a way that will at all address the gap in funding that we are staring down on July 1st. So this year is not going to be a fun year. The Medicaid reductions are dramatic. Things I never thought would happen are happening. And basically, the Medicaid gap is so big that it cannot be recovered from the Medicaid program. And so my colleagues who do education and human services sneer at me now and say, Medicaid, because we're starting now to creep into K through 12, certainly higher ed, and human services programs as well. If that wasn't bad enough, the federal government has seen the light and now they're focused on deficit reduction, which means that grants to state and local governments will certainly be part of that and will be a big part of deficit reduction, quite frankly. So we've got pretty stagnant revenues. We got a big Medicaid gap, and we've got the federal nipping at our current year funding as well as our funding for 2012. So this is not a great time. However, it has been a wake-up call for state legislatures because now facing a Medicaid expansion, which in some states is way beyond dramatic. If you're in the South, we're talking about a very dramatic increase in the number of people who will be on the Medicaid program. They don't see how they're going to finance that. And it's not women and kids that are going to break the bank. It's providing for long-term care for people with multiple chronic illnesses and people with disabilities. And so all the talk now is about what are we going to do to deal with that part of Medicaid. In conversations about the bigger expansion that's going to take place, they expect that they're going to pick up a number of disabled people. Who are these single people who aren't working, that are very low income? Why aren't they working? There's a fair chance that some of them are going to have substance abuse, mental health problems, or they've got some sort of disability or chronic illness that makes it difficult for them to work. And so we're expecting that as we try to absorb these new people into Medicaid, we've got a number of challenges. And you talked about workforce, and that's clearly one. States want to move to home and community-based care. There is an insufficient infrastructure to support that. There are concerns about home care. How do we know what's going on in the home? If we're going to spend a lot of money on home care, then we need to know what we're getting, and it's not just the workers that they're concerned about, but the clients. And are they getting what they're supposed to get? Are they being mistreated? Are the workers trained in a way that they can provide quality care? And so when I got this invitation, this whole co-op thing sounded really interesting to me because I think it's something that legislators would be very interested in. Because let me tell you the things they're talking about. So we've got to build an infrastructure to support home and community-based care. We'd like to see something that's localized, where people feel comfortable with the people who are providing the service. Because what you have family members, and we need a payment stream. We don't really have much of a payment stream for home and community-based care. We have a payment stream for nursing homes. That's very clear. When it gets to home care, home health, not so much. And so we've got to start building that infrastructure. We have to, credentialing, I think, people always, credentialing, ooh, money, ooh, training, ooh. But I think credentialing is something that has to be talked about. If you're going to expand, then you've got to make sure that there are parameters around what the job is, what the people do, and what they're trained to do, and what the expectation of someone who's providing that service is. And so I like the idea of the co-op. One of the things that legislators are talking about is because we have a shortage of workforce in health, and we keep losing people in the healthcare workforce, they're going to work in the service industry because it pays about the same. And in some respects, the service industry, things that they're going into are easier than having to lift patients and things like that. So how do we make this an attractive area for a workforce? And what legislators are thinking about, what they're talking about, is starting young, starting in middle school and high school, to try to get people interested in the health workforce and the full array of health professions. And that then you go from that to junior college. And you have your junior colleges support some things. And then you have your state universities and, creating this public infrastructure that's supported by the state and the communities. And so that people want to do this work and they see a future in this work. This isn't just something we're doing till I can do something else, but it's a career. And getting people interested in this as a career, supporting people in their community as they age. Interestingly enough, I was in Japan in November, and while we were mostly talking about economic development, whenever we talked about health, we ended up talking about aging. And we ended up talking about, I was in the rural part of Japan that's closer to Korea. Nobody goes there. But we went there, and interestingly enough, they're like many of our rural states. They're young people, graduate from high school, and they go to Tokyo or to any of the other bigger cities. And the infrastructure that they used to have, which was a family infrastructure, is falling apart because kids are not staying at home anymore. And so they have the same problem we have, where you have elderly people without family to support and help them as they age. And they, too, are looking for ways to keep the young people in the community working in the healthcare area to help support their aging population. There are so few jobs in the rural areas, and it's exacerbating that problem. So it's something we all share. Legislators are talking about managed care for everything. Managed care for the elderly, managed care for the disabled, managed care, because they think that somehow that will help them contain costs. As you know, managed care in rural areas is a tough fit. And so I think that you bring something to the table in terms of some alternative thinking that might be useful as they look at what do you do in rural areas to support people in their homes. And I think it also would inform some discussion about what to do in some of our urban areas as well. I mean, I don't think the co-op thing is rural or urban. I think it could take off wherever it is. I think it's very important because the other thing that legislators are doing is they've become very businesslike. That's a cute idea, but how much money does that really save? Or how does that, do you have any evidence that that improves outcomes? How do you make sure that everything is going right in the house? How do you know? What's the oversight mechanism? They're very, you can come up with a great idea, but they want to see the whole plan. And that seed money that was mentioned, they'd be very interested in that. If you could hook up some seed money and then throw them a plan, they might say, well, okay, now we're talking. But if it's going to cost them money up front and there's nothing to show that it's going to work, they'll probably say, that was a very nice visit. Because that's where they are right now. They are very focused because they are feeling a lot of pressure to balance their budgets and to make sure that whatever they're spending is well spent. They are scared to death about this Medicaid expansion because they know at this point in time, most states do not have an adequate network. They don't know where they're going to get an adequate network, but they know they need to have a plan to develop getting to an adequate network, and that's where you all come in. So I urge you to put something together and start talking to some legislators about it. They all love home and community-based care conceptually, but you got to lay it out for them about why this would work. Or let us pilot in an area. Let us show you it can work. I think that's where they are. They want evidence. They don't want to put money into something and then it doesn't pan out because they just don't feel they have it to spend. So they're really looking for ideas. They're looking for examples of things that have worked, and I think you have that. And I think part of it is just getting the word out that this is an active alternative, that managed care is not the be-all and end-all of what we're going to be doing to save Medicaid or save the health care program in general in the United States. So I think they're looking for new ideas. They're looking for ways to get the community involved, and they're looking for ways that will use electronic health records and telehealth, and they are willing to look at regulations that get in the way. They know there are some. But before they're willing to get rid of anything, they have to be convinced that it's worth the struggle to once a rule is put in place, it's tough to get rid of because it has constituents. So if they're going to go to bat for you, they have to feel fairly confident that it's the right thing to do, that this is going to work, and that the regulations are in fact a barrier that needs to be changed. I'm going to stop there because I can tell you all kinds of horrible stories, but you probably know those better than I, and just be part of the Q&A later on. Thank you very much.